is you're going to position the arm in the scapular plane. Where's the scapular plane? Midway between the frontal and the sagittal. It's about right here, okay? Everybody just take your arms and kind of hang out here where it just feels really, really comfortable. You're not here. You're not here. This is the scapular plane, okay? Empty can, it's like you're emptying out a soda can, how you dump it to pour it out. And you're going to ask that person to just lift their arm from their side to about right here. Can you do that for me? And then I'm just going to apply some resistance into adduction. Hold it. Don't let me push you down. Good. And it is an aggressive test because we're using a long lever arm. And what am I looking for? You can relax. It's just pain or weakness in the supraspinatus. It's really trying to isolate it. We're putting the supraspinatus on a little bit of a stretch. The other one is the open can. So you're holding the can in your hand and you're repeating it. You're just going from here to here. Hold it there. Don't let me push you down. Hold, hold, hold. Again, looking for weakness or any reproduction of pain.
What's the reason for turning?
Okay, the turning, the supraspinatus is going to be on a little bit of a stretch. And so when you ask them to contract, those fibers are elongated, and you're putting it more in, even though it's not a two-joint muscle, you're fully stretching it and then asking it to contract. You're looking for pain and weakness. When it's in this position, it's really just in its natural position going from the scapular spine to the greater tubercles. The fibers are just directly lined up. Does that make sense? One's more of a stretch, and the other one, open can, is really just perfect alignment of the fibers.
Open's the same, it's also called full can?
Yes. Open, full can. Empty can. Yeah. Open can is probably the old terminology, sorry. Okay. All right, drop arm test. This is not the dropping sign. This one's a drop arm test. It may not be located in there. It's kind of the old term we always utilize when we test it for rotator cuff tears. Okay? What you do is you take the patient's arm and you place it into 90 degrees of abduction. At this point, I'm going to let go. I literally kind of back up and I look at the quality of their movement. If all of a sudden she starts to do this and she can't even hold it there, that's usually a good indicator that the rotator cuff is probably torn because she does not have the supraspinatus that's holding it in and she's getting this lifting of the humeral head. If, though, she's kind of struggling, I see some muscle guarding, but she can hold it there, then what I'm going to do is I'm going to stabilize. I'm going to say, don't let me push your arm down. And I'll apply pressure. Usually I don't even have to apply that. I can put 2 fingertips here and it just drops because any little bit of resistance, did they do the drop arm test on you or they didn't even have to?
Well, they tried it and then they did this test for pushing in. They did the empty can.
Yeah, yeah.
I want to ask you too about the supraspinatus. Is it true, like it pretty much just does this motion? So if you have a torn supraspinatus, most people kind of lean over and creep it down to get over it.
Absolutely.
Okay, that's what they told me.
Yeah. The supraspinatus, that's why we're doing the empty can and the
Just
full can.
kinda like this.
It's just where its fibers are in the position that when it contracts, that's its greatest angle of pull. Because see, after you get past 30 or 40, it's more the deltoid that is going to pull it up, and then you just keep on having that supraspinatus pull it in.
I do know with this one my surgery arm, but this one, it started when I was 16 and I had a 4-wheeler accident. I broke my wrist. Well, then I realized I loosened.
Yeah.
They said that's why when I dislocated my shoulder, I didn't tear anything because my shoulder's so loose.
Yeah, the capsule.
But I had a lot of pain when I tried to work out. So I can tell you the band exercises are awesome because as long as I do those band exercises, I have no pain.
Yeah.
But I have to
The
do
muscle.
them like at least twice a week.
And why is that? Because the rotator cuff
Yeah,
is your
holds it.
integrity of your shoulder. Remember, the capsule just,
Yeah,
It's
because
not very
he said
strong.
it's running around in there, but if the rotator cuff is strong,
yep,
it holds
Got
that
it.
nerve.
yep.
And they do
Okay. Hawkins-Kennedy test, if you can sit for me. Okay, This one's gonna look for an impingement primarily of the supraspinatus. What we're gonna do is we're gonna abduct and we're gonna flex this elbow to 90 degrees and we're gonna bring it across. And a lot of times as I'm bringing it across, they're gonna start telling me they feel some pain. But then the real key is when I begin to internally rotate it. Ooh, does that hurt? No, it's weird. It's just weird. Okay. I thought she was going to tell me, oh, that hurts. So you just kind of start bringing it across to their body. You'll even see me just do this because I'm putting the stretch on that supraspinatus. And then I kind of want to crank it into internal rotation. So what I'm doing is I'm taking that supraspinatus tendon. It's already up here caught underneath the acromion, and then when I go across and internally rotate, I'm just doing a little shear of it across, or I should say underneath the acromion. And if it's inflamed, it's just going to increase pain. So it's just a way of telling me as a therapist, yeah, it's looking like you've got rotator cuff tendonitis and impingement. Okay? Mears test, you're going to take the arm, you're going to maximally internally rotate it, and you're going to ask them to perform shoulder flexion. Okay. And you can see there that that's going to cause that impingement, or see if there's any tendonitis of the supraspinatus, even the long head of the biceps tendon. You're just looking for reproduction of pain. We're not looking at the quality of the movement or anything like that. But if they're inflamed in this biceps tendon, they're inflamed in that supraspinatus, and you internally rotate it, again, it's, ooh, nice little pop right there. Any pain with that? No? That she's going to admit to? Okay. Apprehension test. You can lay down supine, head down here. If I have suspicions that she's experiencing some laxity in the anterior capsule, or if she comes in and she tells me that she's dislocated the shoulder, but there's been no surgery or anything like that, I want to get an idea of how lax is it. At what point is it literally going to feel like it dislocates? Because that's going to help me with kind of the limitations that I put her on. So I'm going to start here in abduction, and then I'm just going to ask her to externally rotate. And it's called an apprehension test because what I'm looking for is her facial expression or her immediate ability to grab her shoulder and say, look, it's going to dislocate. So when I go into external rotation, that causes an anterior glide of the head of the humerus. It's going to start, I can even see when you feel this, there's the head of the humerus. It pops right up into my hand. If that capsule's weak, it's going to have a tendency to go further than it should, and she's going to stop it because she knows that's the mechanism of the actual dislocation. Okay? So I get an idea if I'm going into external rotation and she feels like it's going to dislocate already, I mean, that's telling me the amount of actions that I have to limit with her. So that's the apprehension test. Okay, speeds test, and then Jurgensen's test. You can sit for me. Speeds test, bicipital tendonitis. Flex the arm to 90. Externally rotate. We're looking and actually palpating for that biceps tendon, hiding right underneath there. Push up into my hand, harder, push, push, push. And I'm looking for reproduction of pain over the long head of the biceps. Did that hurt? No? Okay, and push up again. So that's the speeds test. Jurgensen's is we're actually looking for if the transverse humeral ligament is intact. Remember the biceps tendon, you can pluck it like the guitar string, and that transverse humeral ligament is over it. Forceful contractions of the biceps tendon may tear that transverse humeral ligament. So what I'm going to ask her to do is flex her elbow and at the same time kind of supinate, and I'm going to resist her into extension and pronation. So bend your elbow for me. And I'm going to place my fingers on that bicipital groove, try to feel where that transverse humeral ligament is. And I want you to pull your elbow or just bend your arm more towards you. Okay, go ahead, go ahead. And you're going to see that I'm going to push down and into pronation. And if the contraction is forceful enough, it may allow that biceps tendon to pop out over the greater tubercle because that ligament isn't there, and you'll hear almost an audible pop, okay? So we're just looking to see if that ligament's intact. Remember, PTs might be that first line prior to referring them on to an orthopedic physician. And if I find that, I'm like, we might need to have that repaired. So just kind of getting an idea. The last three, AC shear test. You take your hands, you're going to cup them over the acromion and clavicle, and you're going to do exactly what it sounds like. You're just going to get a nice little squeeze, and what that's going to do is cause that clavicle and the acromion to kind of buckle up against each other. And obviously, if the clavicle's hanging out here and those ligaments are lax and I go to squeeze on it, that clavicle's just going to stick up even more. Reproduction of pain, and then you'll see me kind of do some things like this just to get an idea if I can feel that clavicle keep popping up, and that's going to give me an idea of how bad the tear is. Okay. Adson's test and the military brace test are all for thoracic outlet syndrome. What was thoracic outlet? If you,
Impingement between the pectoral,
yeah. So, and it's the impingement of what?
artery, vein.
Artery, subclavian, artery and vein, and
Nerves.
brachial plexus nerves. Okay, they really haven't defined into their individual nerves yet. So I'm going to have you stand for me, Sam. And if I suspect thoracic outlet, she's complaining of tingling, numbness down the arm, I've got to rule out, is it thoracic outlet or is it carpal tunnel? So what I'm going to do is I'm going to first find her pulse here, radial, nice and strong. And then what I will do is I will take her arm into hyperextension, abduction, external rotation, still feel the pulse. Now can you look towards me, Sam, and now look down into your armpit? There you go. Still nice strong pulse, I didn't lose it. If I lost the pulse, what we're doing is we're taking everything and we're kind of compressing it in that area and then stretching over the coracoid process. If you lose the pulse, you know that you kind of cut off the blood supply to that subclavian artery and vein. And that would be a positive test. I know that something's getting impinged within that area, okay? If she complains of a lot of tingling and numbness, that's also indicative, probably of thoracic outlet. And then I'm going to teach you in the next few weeks how we do the Tennell and Phelan sign to rule out if it's carpal tunnel. Because sometimes that tingling and numbness, I don't know, is it thoracic outlet? Is it following a particular pattern? Military brace test will do the same thing. And I'm going to have you stand a little bit more forward, and you're going to stand up nice and tall, shoulders back, and we're going to get that head way back, really exaggerate, military position, okay? I'm going to palpate for the pulse on each arm. Where's your left one? There we go. Okay. And then I'm going to take both of these back. No, it's there. Okay. Really, did you feel any tightness or anything in there? A little bit? Pec minor? A little bit? Yeah, she's fine. Any tingling, numbness down the arms? No. Okay. Negative test. She was perfect all the way through. Negative, negative, negative. No positives. Okay? You do not have to be competent in performing them, but I would like you to go over those. Each one, just kind of take you through the paces of it. On an exam, you need to be able to match up. If I would say it's an Adson's test, you know you're looking for thoracic outlet. When we say Speed's test, we're looking for the biceps tendon. What does it go with? Right? Okay, give that a try.